Statistically, it's safe to assume that most of the people in this room have contracted COVID at least once. For some of us, the reactions were relatively mild, but for others, much worse. But why? Why was there such a vast spectrum of reactions, consequences, mortality rates? Early on, we saw all the correlations and then the connections: obesity, old age, and others. But in all that research, as doctors around the world were racing to try to better understand who were at the greatest risk, I happened to be sitting at home. As a periodontist, my main job is to look inside of people's mouths and address the inflammation around their teeth. Now, as you could imagine, during the outbreak of COVID, people didn't exactly want to be centimeters away from my mouth. And my job wasn't exactly the kind where I could work from home. So I had a lot of free time on my hands. And it was during that free time, sitting at home, reading research papers, trying to make sense of what was going on, and I saw something. I saw something that went under the radar, unnoticed. People didn't talk about it. Something that provided critical insights of who could live or who could die. I observed that every time this certain biomarker in our blood called interleukin-6, whenever it spiked past a certain threshold, people would then go on a ventilator. And of those that were on a ventilator, 80% of them died. But here's what struck me. All my patients with gum disease also had this biomarker elevated. People weren't dying of COVID alone. They were dying of uncontrolled inflammation. And regardless of their age or weight, people with gum disease were consistently at a higher starting point of inflammation, so that when they got COVID, that distance between the danger zone and where they were wasn't that far away. Later, a radiologist and I published an article together showing how the virus actually travels into our lungs. And it wasn't what people thought. People thought it was actually coming in through the airway, but in fact, it was coming in through the mouth and into the bloodstream and then to the lungs. So I published our research and launched a worldwide campaign to tell the public, actually, don't skip your dental cleaning appointment. Go to the dentist. Get your gums checked. And later it was confirmed that people that had gum disease had a 71% higher chance of dying when they got COVID. Gum disease is linked to over 50 chronic diseases. Yet, the mouth and the body, they're treated as if they're separate worlds. Your doctor and your dentist, they have very little regular engagement with one another. We don't share charts. We don't share labs. We don't coordinate treatment plans. Each specialty in healthcare looks at its own lens, one looking at the heart, another at the lungs, another at the mouth. But there are very few who are trained to see how they're all connected together. And that invisible wall between our professions, that's what costs lives. And it deteriorates the trust our patients have in our profession. Now, early in my career, I was referred by dentists some cases that patients had this really puffy, swollen gum, almost spilling onto their teeth. This is also how someone could look like if they just never brushed their teeth or flossed. So you can get fooled sometimes by seeing that. But if you dig into their chart, you'll notice some of these patients are taking a blood pressure medication called amlodipine. Amlodipine has a side effect for some people of this puffy, swollen gum. Yet not one patient to this day that's ever been referred to me has been told that. So imagine how shocked they get when I tell them this could be a side effect and it's been going on in their mouth for years. They get pretty surprised. Their doctor prescribes it, their dentist sees it, but no one ever made the connection. And when dentistry and medicine, when they don't speak the same language, the ironic and sad part is that a medication meant to lower our blood pressure can actually make it worse, because this local inflammation spreads systemically and then it can increase the blood pressure. Even if I perform a gum surgery to fix this, it often comes back because we're not getting to the root cause of it, which is that medication. And, this happens. This isn't a remote occurrence. Far from it. And this divide, it creates another type of gap. A gap in trust. It's something you'll see in dental offices all around the world, from America to Asia. Patients coming in, complaining about their previous dentist, saying they should have never touched that tooth. It's been nothing but problems ever since. One patient says, my dentist told me I have 6 cavities. Another said I only have 1. One told me I need a root canal. Oh, the other one told me I don't, so I came to you for a third opinion. You have the same patient, same set of x-rays, similar type of exam being done, and you could have like 5 to 10 different opinions. And in every one of those cases, the dentists are working with incomplete information. But it's not that any of these dentists are unskilled or uneducated or unconcerned. It's that ever since its inception, dentistry as a profession has been fundamentally siloed, completely separated. For example, gum disease is linked to 2 to 3 times higher risk of heart attacks and strokes. Yet, a national survey published in Academic Medicine shows that 70% of all US medical schools offer less than 5 hours of oral health curriculum. It's like less than a day. And 10% offered none at all. And these same gaps show up in dentistry as well. And when they do, the patients feel like their care is less reliable and less consistent. And it's that consistency that builds trust. But naming the problem is the easy part. The real challenge here is, how do we make medicine and dentistry more connected? How? Are we going to send every doctor to dental school? Are we going to send every dentist to get a degree in medicine? Obviously not. And any attempt to try to retrain hundreds of thousands of professionals who are already out in the workforce would certainly be doomed to failure. Now, 10 years ago, this might have been the end of the discussion. But today, there's another option. Maybe we can't retrain every doctor and dentist overnight. But what we can do is give medicine and dentistry one shared language: data. Over the past 7 years, I've had the privilege of working with a lot of different dental technologies. The first step in building this bridge was focused on dentistry itself. Dentistry in general, historically, has been highly subjective. So when I'm checking someone's gum, the pocket depths, it's very arbitrary. Depends on the pressure you put, the angulation. The hygienist does it one way, the dentist does it another. And if you're 1 millimeter off, it can mean someone that needs a cleaning instead gets a gum surgery. Or if someone that needs a gum surgery, instead they get a tooth extracted. So that's the first step. Can we make the language and practice of dentistry more precise and more data-driven? And the answer to that is an absolute yes. The future is here. We now have AI-powered probes that can check the gum. It has a pressure sensor. So now, whoever in the office, the hygienist or the dentist, whenever they check the measurement, it's going to be standardized, precise number. And when the patient goes to another office, they could see if they're actually getting worse or better. We now have AI-powered X-ray detection that can see 37% more pathology than the human eye can see. Our eyes see 30 to 50 shades of gray. AI-powered machines can see hundreds, so we can catch cavities much earlier and see how deep they are and if they're spreading. With each advancement, we've been able to make the practice and language of dentistry more precise and more consistent. And it's this consistency that has allowed us and laid the foundation for us to take the next step. My team and I have built our own AI system where it takes all of the data from the office, the x-rays, the periodontal data, the medical and dental history, the medications, saliva and blood tests, pulling it all together so we have one unified picture of the patient. To give you an idea of the scope of what we're talking about, it's been trained with the equivalent of 100 million pages of textbook knowledge. And that knowledge is not just textbooks, it's research papers, specialist feedback, real-life cases. And it's not just in dentistry, it's in medicine and dentistry, the first of its kind to be specialized in both. And we're proud to say it's gotten so good that recently it just got a 100% score on both the US medical and dental board exams. And we truly hope that we're only the first of many more to come that are going to help transform this field. The fact of the matter is, we're entering a world where every time you're at your dentist's office, when you open your mouth, it's going to be like thousands of medical and dental specialists looking inside, sharing notes, discussing, finding new connections, and offering solutions that not even the very best in the world can do alone. And with no more guesswork and full transparency, we're now creating trust scores, which is a % confidence level that the AI has. So doctors, dentists, and patients, we could see now how trustworthy the AI is because it has a % confidence level. You could ask it questions and push back and ask, why do you recommend that? Show me evidence for that. Nothing's 100% in life. And with each question, we're able to get closer and closer to the truth. Transparent, collaborative, holistic, consistent care. We're entering a new age where medicine and dentistry finally live inside one system, one AI brain, where every part of a patient's health becomes connected and measurable. And when that happens, patients won't just believe us more. They'll understand us better. And they'll believe in the system. And then they'll act on it. I'm very optimistic for the future. After so many years of lost trust and working in silos, it's finally time for the mouth, the body, and trust to come together. And when medicine and dentistry finally live inside one system and speak the same language, as we saw with COVID and the gum swelling, we'll stop treating symptoms in isolation and start healing people as a whole. So, if you want to know what the future of health looks like, then just open wide and say, ah. Thank you.